Welcome to Hearts and Souls and our book review of How We Do Harm by Otis Brawley, MD, and Paul Goldberg. Otis Brawley is a highly credentialed physician with many titles. He was Chief Medical and Scientific Officer of the American Cancer Society for 11 years. Dr. Brawley made his way through the ranks as a man of color who carried burdens of race and poverty which are frequently reflected in his estimable writing. In his book, Otis threads his life and training through a maze of cancer patients, medical studies, statistics, and research. Brawley's How We Do Harm might just as well have been called How Money Runs Medicine. This doctor's particular concern is with cancer patients. He gives many examples of how financial incentives, commercial opportunities, conflicts of interests, etc., often steal the show, so to speak. He says, too often helping the patient isn't the point. Economic incentives can dictate that the patient be ground up as expensively as possible with the goal of maximizing the cut of every practitioner who gets involved. When we doctors are at our best, we set aside our self-interest and put the patient's interest first. When we aren't at our best, the public pays more in fees, insurance premiums, taxes, poor outcomes. Poor Americans consume too little health care, especially preventive health care. Other Americans, often rich Americans, consume too much health care, often unwisely and sometimes to their detriment. The American health care system combines famine with gluttony. But, Brawley says, patients need to understand that more care is not better care, that doctors are not necessarily right, and that some doctors are not even truthful. Otis Brawley is a shrewd man, knows his business, which includes cancer, medicine, finances, politics, statistics, and more. He believes that science is the answer to medicine's problems. Brawley is also a man with a heart. He talks to patients at home on the phone. If someone gets his number or attention, he will oblige that person with a conversation. Otis started out with a scholarship to a Jesuit high school and reveres his mentors. But Brawley neither invokes religion or God nor powers of spirit and community. Science is really his way. He believes that physicians only need to know more science, study more, do more research, read more drug inserts. He says, few doctors read the entire label before prescribing the drug. I do. Brawley is convinced that humans and physicians in particular nearly need to know more science and more science. But then knowledge is ever-changing and subject to all sorts of less than honest and factual influence. Father Polakowski at his Jesuit school in Detroit taught Brawley to say what you know, what you don't know, and what you believe, and label it accordingly. Dr. Brawley might be served even better by the sage words of Mark Twain, who might have told him, it ain't what you don't know that gets you in trouble. It's what you know that ain't so. Brawley does admit that over the course of history and into modern times, medicine has known for sure what is best for human ills and injuries. The problem is that medics and surgeons and science have often been wrong, tragically wrong, and they continue to be commonly so. Brawley's admissions are hardly new, although well elaborated and forceful. Charles Sidney Burwell, dean of the Harvard Medical School, made it a habit generations ago to speak with incoming classes on their first day. Burwell gave a similar pep talk each year and always threw in a proviso about their medical education. He said, "Half of what we teach you here will be outdated or simply shown to be untrue in 20 years. The problem is that we don't know which half that is." Dr. Brawley admits quite the same as he tells about being brought up in the medical and then the cancer system. He tells how medical oncology was invented at the National Cancer Institute in the 50s and 60s, how he became part of an old boys club from which all cancer programs in the USA were spawned. Brawley believed, as a conscript to the war on cancer, that the cure was just around the corner. Only a core strategy needed to be executed. For many years, that amounted to the summation that anyone who died of cancer died because he didn't get enough chemo. Brawley wrote that the power of cancer to kill is so fearsome that treating it naturally invites the metaphor of war. As oncologists, we crave big weapons and are eager to throw them into the field. This is our mindset, our history, our culture. Sometimes it's our folly, our madness. While Brawley still strives toward a clean system based on science, he recognizes that human factors influence medical trials, drug and procedure studies, screening efforts, and shares a number of horror stories on mistreatment and overtreatment of cancer patients. While even in daily situations, he says, cancer patients and their doctors routinely accept horrific risks as they inject drugs intended to cure cancer or slow down its process. He says, sometimes we treat 100 people to benefit 10. All 100 will be subjected to harm, and 90 people will pay the price for the lucky 10. Cancer is hard to understand, and doctors rush patients. It is not patients only who do not understand cancer, neither do physicians. The medical profession doesn't know what causes cancer any more than they know the cause of the majority of medical conditions. Thus, almost all cancer therapy is experimental, shooting in the dark. Brawley remembers sadly that folks I grew up with were worried that the doctors who treated them had no idea what they were doing, that they were experimenting, trying various drugs or treatments, hoping that something might finally work. My family members were afraid they would pay the price for exercises in trial and error. It was about trust. Physicians are still, quote, practicing on patients, and no more powerfully and dangerously than in cancer diagnosis and treatment. Thankfully, people like Otis Brawley are still asking questions like, how can we identify the cancers that are a threat to a man's life and need to be treated from those that are not a threat and need to be watched? But the war on cancer has been running full bore for 2 generations. Science has not met the challenge. People still die regularly and horrifically from cancer and its treatments. A friend of this reviewer, whose daughter died of cancer, once remarked that, quote, more people make money on cancer than benefit patients by their treatment. That is, in so many words, the foundation of the book, How We Do Harm. Dr. Brawley concludes his book with the following pronouncements. The system is not failing. It's functioning exactly as designed. It's designed to run up healthcare costs. It's about the greedy serving the gluttonous. We need a healthcare transformation. Americans need to change how we view healthcare. We need to change how it is provided and how it is consumed. Otis Brawley is currently professor of medicine at Johns Hopkins University.